Good evening, everyone, and welcome to 3-minute videos. Is there any way by which we can master, we can champion the concepts in small bite videos? Let us give a try to spice up our preparation. In all these 3-minute videos, I'm only going to discuss about what is very crucial, definitely asked in the tomorrow's exam. So what is definitely asked in the tomorrow's exam? Mastectomy is the hot topic for the examiner. Whenever we talk about mastectomy, we talk about the axillary lymph nodes. So now let us talk what is meant by level 1, level 2, level 3. Everything is in relation to pectoralis minor, not major. Below and lateral, you call it as level 1. Those lymph nodes which are posterior to pectoralis minor, you call level 2. Those which are medial to pectoralis, you call it as level 3. So typically, apical group of lymph nodes, they come under level 3. Whereas central, interpectoral, they come under the level 2. And anterior, posterior, lateral, they all come under level 1 is what you need to remember. Now, what are the variants of modified radical mastectomy? There is one Austen-Claus procedure, Patty's procedure, Scanlon's modification of Patty's procedure. These are all the favorite multiple choice questions for the examiner. Okay, what is Austen-Claus? You'll be removing all the breast tissue, the nipple areola complex, the skin, and the level 1, level 2, level 1, level 2. That is Austen-Claus. Whereas Patty's, P for pectoralis, remember. So pectoralis minor is removed so that you will be able to even do the dissection of that level 3, that is apical group of lymph nodes. Then the Scanlon has modified Patty and said, don't remove pectoralis minor, but you divide the pectoralis minor instead of removing. And the division of the pectoralis minor will allow you to still able to reach to apical group of lymph nodes, and the level 3 axillary lymph nodes are being removed. Now the next question comes. Breast conservative surgery, what are the indications? Favorite topic होता है कल के examiner के लिए. Be very sure about it. So, what is breast conservative surgery? Mainly, you will be removing the area of the breast where there is a cancer, along with the margin of normal appearing breast tissue. Then you will give adjuvant radiation therapy. Now, in the breast conservative surgery, a quite often asked question is, what will you do with the axillary lymph nodes? It all depends upon the lymph node status, if mets are there or not there. So based on that, you need to take a call whether to retain or remove. So what are the various types of breast conservative surgery, doc? Wide local excision, lumpectomy, quadrantectomy. So one of the favorite MCQs comes now. Breast conservative therapy is considered to be the treatment of choice for a good subset of population among the breast cancer patients. Those who have ductal carcinoma in situ, stage 1 and stage 2 invasive breast cancer, for them the breast conservative therapy, tomorrow's exam also they are going to ask you. So if I ask you what type of patient is the most suitable candidate for a conservative therapy like lumpectomy, quadrantectomy, what is your answer? If the cancer is solitary, so that there is no clinical or a mammographic evidence that it is there anywhere else, that is very important. And if you have the tumor so localized that you still are getting free surgical margins, then you can do conservative therapy. And there should not be any contraindication to radiation, because after conservative therapy, radiotherapy need to be adjuvant. And the patient should be willing and motivated for the breast conservation. Now comes next the favorite question of the examiner. What are the absolute contraindications, relative contraindications? These things should be in your fingertips. Pregnancy, absolute contraindication to use irradiation post BCT. That's the reason it is an absolute contraindication. Surely the women who have 2 or more primary tumors in separate quadrants of the breast, contraindication. Similarly, any microcalcification or a diffuse malignant appearing breast carcinoma, absolute contraindication. And any history of previous irradiation and that irradiation and this post-BCT adjuvant irradiation together become too much irradiation, hence that becomes a absolute contraindication. If already patient had a past history of prior therapeutic irradiation, now that's a contraindication. Similarly, any persistent positive margins after a reasonable surgical attempt is considered to be absolute contraindication. You're not going to forget. Then what are relative? All medical disorders you can remember. Collagen vascular disorders. Similarly, multiple gross tumors in the same quadrant also is a relative contraindication. And multiple tumors in different quadrants is an absolute contraindication. Please don't forget. Any indeterminate calcifications is a relative contraindication. As large tumor in the small breast, you can't do conservative therapy. Similarly, a breast size, a large pendulous breast, they all become difficult for you to deliver the radiation ultimately. So that is the reason they become a relative contraindication. Any centrally located tumor for which the removal of the nipple areolar complex is required to get the free margin, that is also a relative contraindications. Will you remember all these things? Because they're all the crucial things tomorrow in the NEET PG exam, USMLE or MBBS exam. Anywhere you go, all these things you must be ready, just like an oncosurgeon, right? Now, coming to the radical mastectomy, what are the indications? In my previous video, I told you what are the differences between various types of mastectomy. Please don't forget to review that video. A large bulky tumor involving pectoralis major muscle of the fascia or the fascia become indication for radical mastectomy. Any bulky involvement of the axillary lymph nodes, radical mastectomy. Any interpectoral node involvement in which the fascia of the muscle is also involved, that is a indication for radical mastectomy. Acha, what are the contraindications for radical mastectomy, doctor? This is one of the favorite questions. Any non-palpable or a small tumor, advanced disease with the distant mets, those who require reconstructive surgery is a radical mastectomy contraindicated, and any diabetes, CHF, CRF, they all become relative, they all become the contraindications. That is all the story of mastering the concepts in 3 minutes videos on the Incus Train app, and keep playing quiz tournaments on Incus Quiz app and keep yourself engaged. Similarly, while you are studying also, if you want to do revision, take the Incus Train app and start uploading your 3-minute video and become useful for the entire world with your knowledge. Thank you.